These 10 junior doctors have been chosen to be our surgeons of the future. They've read the books, they've learnt the theory, but now the practice is over. As trainee surgeons, they get to operate for real.
It's a little bit overwhelming.
Over their first year, we're following them as they get to grips with real patients. From toes to tonsils, they'll be operating.
It's a little bit nerve-wracking.
And it could be on you.
There's always something in the day that makes you feel like an idiot.
The fear that everyone has is you're actually not cut out to be able to do it.
We'll find out if they have what it takes to become top surgeons.
No thanks.
Our trainees have already studied medicine for 7 years. Now, they're on one of the world's best and most competitive surgical training programs.
If you are not good enough, we will fail you.
Out of 2,000 who apply, just over 100 are chosen each year.
Good is not good enough. We're looking at excellence.
Surgeons need to learn on the job, just like plumbers or bricklayers.
Yeah, perfect.
It's all about getting hands-on training.
Just lift up your leg for me.
This episode, we follow 4 of them in busy London hospitals as they struggle to get that experience.
How are you feeling?
There's a lot at stake. If they don't progress, they will fail the end-of-year exams and be asked to leave.
Oh, is that Amy?
25-year-old Essex girl, Anita has developed a passion for surgery.
I think there's something I can't quite describe. It just makes me more excited just thinking about going into theatre, getting to do operations, getting to do more than holding a retractor, and I get excited by that. I think it's the blood and guts. It's cool.
She set her heart on becoming a plastic surgeon, one of the most competitive specialities.
I really want to like grab every single learning opportunity, any single sort of operating opportunity, and this is what I want to do.
She has to impress her new team at Guy's and St Thomas's.
Every specialty is competitive, surgery is competitive, so what are you going to do about it?
First up, a finger that's been trapped in a door. Senior surgeon Mr. Tajero will judge whether Anita can do the precision stitching required in plastic surgery.
I was never squeamish. I was just fascinated. It's like when I was younger and I'd watch the X-Files and it was very gory and my mum was like, oh no, turn that off, why? How can you watch things like that? I thought, oh, it's cool. Oh, it doesn't bother me in the slightest. Every time I've done plastics, I find it fascinating. It's more delicate and you have to take a bit more care, and also it helps me improve in terms of my movements, my handling. This is a little bit more sort of refined.
So all done. So we're going to put the dressing, and that's it.
But this is a relatively simple wound. The real test will come with more delicate and complex operations.
The more you do, the better you get, and that's the one thing with surgery. It's practice and repetition.
This is how we train. This is the breakfast of surgeons.
It's going to be a long day, so Smittesh Patel is building up his strength.
This is the thing that keeps me going, keeps me awake, and makes sure I can work and operate through the day.
Smittesh was born here at St Thomas's 26 years ago. Now he's back and has just started in the orthopedic department fixing broken bones.
Surgery is absolutely the only thing that I want to do, yeah. I don't think anything would stop me, unless somebody told me I was so bad that I'd never make a good surgeon. But that hasn't happened yet so far. All right, Florence, how are you feeling today?
I'm fine.
Today, mother of 11, Florence, is having her fractured hip repaired.
I was all right 1 minute and on the floor next.
The NHS carries out 100,000 hip operations every year. It's just the kind of surgery Smittesh needs to learn.
It's a relatively routine procedure, so I know the principles of doing one. It's just a case of being the next in line to actually get down and do one.
But when he gets there, there's quite a crowd.
What we do is, before you do anything further, Mark, just get this down.
His senior surgeon, Mark, begins the operation.
I'm relatively junior to Mark and Jeremy. There's a hierarchy in your training, and rightly so. You know, the further along you are, the more that you'll get to do more complex procedures.
An hour in, and another senior trainee is given his chance. The operation is finishing, but Smittesh has done nothing but watch. His registrar, Nick, has nearly completed his training, so he knows how it feels.
I mean, it's frustrating for him because there's actually been 3 of us here, so he's fallen right to the bottom of the ladder. He's been left not being able to do anything.
It can be pretty frustrating sometimes. I've read about this procedure, read about how to do it, and it's time. I'd like to have a go at doing it.
Sometimes training means being in the right place at the right time. To increase his odds, Smittesh will have to make sure he never misses an opportunity to be in theatre. Out of the 110 trainees, Honor Gilead was one of the very top students.
I think I am very ambitious. I can't imagine not wanting that. I can't imagine just thinking, oh, I'll just do this and just be average. You know, you try your very best to be the very best, and that's always, I think, going to be the aim.
Today, Honor's on the front line at Hammersmith Hospital. He's seeing patients in A&E and having to make critical decisions.
A fair amount of our time is spent doing this. We're not always in theatre being taught how to operate. You know, you need to, like, being a surgeon isn't just about literally doing the technical operation. You know, patients need to be looked after. I thought the consultant thought it was a UTI.
Honor gets an urgent call.
Yeah, I will do. No problem. Cheers, bye.
We've got a lady who's pregnant downstairs, which is what I was just bleeped about.
Rachel's had a pain in her side for several days. No one's quite sure what's wrong with her.
How many weeks are you?
15.
Is it tender
No,
at
it's
all?
just the
Okay.
side.
That's all.
Yeah, no. Yeah.
Very much.
Yeah, that's all.
When I'm pressing down like that.
Yeah, that's
And when I let go?
a little bit of pain, but it goes.
I'll just have a look at your bloods and stuff. And
Thank you.
I mean, I think that she may have appendicitis, but I haven't seen appendicitis in anyone pregnant in my couple of years on the job yet. And because she is pregnant, obviously this is kind of more complicated than it would be if she wasn't.
Honor's instinct is that Rachel has appendicitis. If he's right, she needs an urgent operation. But it's difficult to diagnose, and a general anaesthetic is a serious risk for the baby.
Just terrified. So I hope everything's okay.
Though Honor's consultant agrees with him, operating could put both mother and baby in serious danger.
The fact that she is 15 weeks pregnant, it's not something that you're going to kind of undertake lightly.
Well, hopefully she's all right and the baby's all right, really.
Honor's judgment is on the line.
So we freed the left lobe of the liver.
she did have appendicitis. The appendix was quite clearly inflamed, taken it out, and now she's better. And, you know, it's a huge relief for her. It's a huge relief for us. The baby's doing fine, so it's a perfect result. So, how are you feeling?
I feel so much better.
Really?
Yeah.
Oh, brilliant. So,
Really
we were
do.
right, is it?
Yeah, definitely.
Your appendix was quite inflamed.
Yeah.
And you just had a scan of the baby?
Yeah, she said the
All
baby's
good?
fine, the heart beating and it's moving and nothing's wrong.
The baby.
Thank you so much.
Absolute pleasure, and I'm so happy you're feeling better.
Yeah, bye.
It's kind of really satisfying when you've seen it, you know, from the beginning to the end. And we saw quite a sick young girl yesterday, really, who was understandably very nervous. And now we see a well, smiling mum-to-be. So, all good.
His advanced diagnosis will be noted by his superiors, but like all the trainees, he has to prove his ability to operate alone by the end of the year. Professor Nigel Stanfield sets a high standard at the school.
This first year for the trainee is a very tough year. We're actually striving all the way for absolute excellence. And that means that if they fall short of that mark, then obviously their whole future career may be in jeopardy.
Right, 1 second.
During a recent hip operation, Smittesh didn't get to do anything.
I'm going to need to take your sock off, all right? I'm really sorry, Mr. Birdie.
Now he's really hoping to find cases he can take to theatre. Today, he's in luck, as a recent cold snap means there are 4 times the usual number of falls and broken bones.
Just got to see a chap who's got a rather nasty ankle fracture.
My foot twisted and I felt more almighty crunch.
Unfortunately, having had a look at your x-ray, you've fractured both the tibia and the fibula. Ideally, the best course of action to stabilise that joint is for an operation. I'll let where she is first. Having looked at the x-rays, okay, I can say that she's broken a hip. All right. She's going to need an operation. Okay.
Hip, she booked a hip.
She's broken the hip.
Both Stephen and Shoryan will be going to theatre tomorrow, but Smittesh will have to wait until the morning to find out if he'll get his chance.
The 2 cases I've seen today are probably things that I would normally do or like to do. Certainly the things that I know about and read up on, I like to think I know how to do. All of us, the whole reason that we do surgery is to do surgery. So that's the aim. Hopefully tomorrow I shall push my way in to try and do at least one of the procedures.
Every morning at 8 sharp, the emergency orthopedic team meet to decide who will and who won't get to operate.
Examining her yesterday, she had a shortened externally rotated left leg. It was a closed neurovascularly intact injury, mild hypertension.
Smittesh must present his 2 cases to the team. He desperately wants to take them to theatre.
Tenderness above the fibula injury as well.
But he's not the only one trying to get experience, and he's way down the pecking order. Will he get his chance?
It's mostly indoors.
Can she leave the house if she has to?
I didn't ask.
Okay, we need to kind of gauge. Oh, yeah, 71. You're a bit worried. No.
After hearing from the trainees, the operations go to someone with more experience.
Tilt the table and then do the lateral side. Get the whole.
Smittesh gets another day on the wards. It isn't the sort of training he needs right now.
It's a bit frustrating. I think today, just because, you know, a couple of things have gone on and I've kind of been lumbered with more work than usual. So that's a bit annoying because I can't even get to theatre to actually find out what's going on or even watch the case. There you go. Today's been a bad day. Sometimes you have to try and make the opportunities as well, but today it just wasn't going to happen. But hopefully in the future I'll have the opportunity to do those things again.
Anita's up early. Today could be a turning point for her.
Sometimes I'm really sprightly in the morning, and it's usually if the sun's shining, and like today, it might take me forever just to do the simplest of things because my brain hasn't woken up. I generally need to have a coffee before I'm fully functional, so. I just want to check, have you got any pain here?
She set her heart on becoming a plastic surgeon.
Nice to meet you. Make sure you get your lungies and your ice cream. She will. Because the doctor said so. I love plastic surgery. I love the technical aspects of it. I love the challenges that you face. It's a very long training process, but there's a reason for for that, and I think plastic surgeons are very excellent surgeons. I love the way they approach it, and I aspire to be like that, really.
This morning, she's hoping to assist in a complex operation with a top reconstruction surgeon, Mr. Healy.
Got a wound created a few days ago.
Their patient is Jane.
Yeah, as long as my nose is okay. Yeah. No, I'm never ever going to look beautiful.
She's allergic to the sun and continually develops cancer on her face.
So what we need to do is think, how might we reconstruct that?
Jane's come in for a skin graft to repair her damaged nose. She's had a lifetime of operations.
I've had it for 40 odd years, and I've just learned to accept it. There's people worse off than me. Loads of people worse off than me. But, you know, I'll just carry on with it. It's got to be done. There's nothing I can do about it.
Jane's operation is Anita's opportunity to prove herself.
I don't really know what to expect, to be honest. So, because it's all so new and there's a lot going on. It's, you know, all very specialised, so.
In this precision operation, Mr. Healy will be judging Anita's every move.
Okay, 5 a vital repeat, please.
It's her job to carefully cut Mr. Healy's fine stitches. Every millimetre counts.
It's a very delicate structure then. That's it. You just knocked my dressing off with my skin graft off. See? You just knocked the skin graft off there.
A tiny slip means Anita has upset the new piece of skin.
When you're assisting in surgery,
Yeah.
it's against the rules to knock the surgeon's reconstruction off. You need to learn that at this stage of your career.
It won't happen.
It's a bad mistake for Anita. She cannot afford to make errors if she wants to succeed as a plastic surgeon.
Surgery is pressure, and learning to cope with stress and pressure, it's part of the job.
Smittesh is trying hard to get the chance to do an operation of his own.
Yes, I do.
But as part of a big surgical team, he's often had to watch while more senior trainees get their chance to operate.
I don't know, sometimes you feel quite thick. You never fully learn everything, and there'll always be something in every day where I'll go home and I'll think, okay, I don't know about that, I need to go and read about it. There's always something in the day that makes you feel like an idiot. To be honest, it wouldn't be a good day if it wasn't.
This evening, all the other trainees have left for the day, and Smith is in charge of the night shift. If anyone comes in for an operation, Smith will definitely get his chance. But it's deathly quiet.
And nights are a bit unpredictable here. Sometimes they can be very busy, sometimes they're not. Who knows, something interesting might actually come in later on.
Smith gets a call.
All right, not to worry. Okay, thanks, that's all right. Okay, bye-bye. False alarm, I'm afraid. Oh well.
Four hours into his shift, Smittesh gets another call.
Great, thanks very much. Thanks, bye-bye. Excellent. Okay, so unfortunately this young chap dislocated his shoulder, so we're going to try and get him into theatre under a general anaesthetic to put the shoulder back in joint. If I'm honest, it's the first time I've actually managed to get to theatre when I've been on nights. So a little bit anxious.
Smittesh has permission to try to pop the shoulder back into place. If he can't do it, he'll have to get someone senior out of bed to help, something he wants to avoid.
Slide, okay, ready, steady, slide.
Can't feel it moving at all. Give it a good pull. If you don't almost force yourself upon theatres, it's very easy to get left behind. The more willingness you show, the more competence you show in terms of basic skills, the more you'll be allowed to do. Do you think you can push the head if I give traction up? There you go.
He pops it in first time.
I'm really pleased, actually. That's a good morale boost, and, well, hopefully I can get some sleep now, to be honest, but something to keep me going for a little while. Adrenaline's going a little bit. Nice to know that we've managed to sort of do a case at night without having to call in any senior help. That's always a nice coup.
Handling a dislocation is good, but it's not the big break he needs. Top student Honor correctly diagnosed appendicitis in a pregnant woman, something even experienced surgeons find difficult.
Okay, thanks a lot. Cheers, bye.
But then medicine runs in his blood. His grandma was one of the first women in Turkey to qualify as a doctor.
As far back as I can remember, I was like tiny, like 5 or 6. Like these medical books that were kind of in my grandma's house. And she used to say to me, one day they'll be like your books and you'll be a surgeon. That's kind of all that I've sort of known, really. And I don't ever remember thinking that I was going to do anything else.
But Honor knows that staying on top means doing well in theatre too.
My ultimate ambition is to be a consultant surgeon, and it's hard, and it's kind of a long way away.
Is there anything that you would like to ask me at all?
83-year-old Bill has cancer.
All right then. Okay, I'll see you a bit later on.
Well, I'm having a kidney removed, and they're going to do it using keyhole surgery, which is a new one for me. I've had lots of other surgery done, but never keyhole. To put it bluntly, I'm looking forward to it.
Using keyhole surgery means Bill will recover quicker. It's also a chance for Honor to find out if he has the coordination needed for this modern technique. A tiny camera inserted into the patient is the only way the surgeon can see what he's doing.
Gotta come and grab the scope there, Honor.
Honor's been given the crucial job of holding the camera. If he gets it wrong, the surgeon won't be able to see what he's cutting.
Good, so that's the kidney there, lower whole of the kidney.
These could be kind of long operations where you do very much have to be concentrating 100% of the time, and you've got to be making sure that the surgeon doing the operation can see what they're doing, and that is kind of totally down to you. So it is kind of big responsibility.
Straighten up the camera a bit. That's it.
Nearly 20% of all operations are now keyhole. It's a skill the trainees have to master.
The fear that everyone has is you're actually not cut out to be able to do it. Might actually not be able to operate very well at all, and that would be the kind of like nightmare scenario that you're asked to leave.
Yeah. That's good.
Inside the body, the kidney is bagged. It's pulled out of a 5-centimetre opening.
Thank you.
Honor's proved that he's got the hand-eye coordination. That's a key skill in surgery.
Honor has very good skills. I mean, he follows the operation really well, anticipates, knows what he's doing. He was pretty much doing the right thing all the time.
You know, there is that kind of adrenaline pumping, and you want it to all go well. And it is a real kind of team feeling. And when you do operations like this, where it's all of you there, it's like a bonding experience. When things go, perfectly as that has, it's a really enjoyable experience.
All the trainees are constantly watched by their consultants, and every slip or triumph will count towards their end-of-year assessments.
This first year is a very, very tough course.
From the wards to the anatomy class, The trainees have to do well in every aspect of their training.
The trainee who does best is the trainee that elbows in. The trainee that does really well is the trainee that's always available.
Only 1 in 4 of all trainees make it to consultant. There's 5 months left, and they're going to be tough ones.
Hi, my name's Rose. I'm surgical assistant on call.
27-year-old trainee surgeon Rose Johns had a tough start. In her first 4 months, she wasn't pushy enough and missed out on operations with senior surgeon Mr. Shri.
Certainly she needs to be a bit more forceful with getting to theatre.
After missing important opportunities, she learned that she had to grab every chance or get left behind. She finally got her big break.
Now, I hope I'm a lot more assertive, and that's something I've probably learnt the hard way in this 4 months, but I've learnt it now, so that's okay.
Today, Rose will need all her newfound confidence. She's starting at King's College Hospital doing mouth, face and jaw surgery.
It is just slow, gradual pressure. See the
A speciality she knows absolutely nothing about.
So someone practice on me now.
After a crash course, her first task is to inject her new boss, consultant surgeon Mr. Matthews.
I'm terrified, Rose. I'm terrified. God, what's he going to do to me?
We're going to give you a little injection now, if that's all right, just to numb your teeth up.
She's never stuck a needle in someone's mouth before.
Why don't you try doing my lateral incisor tooth, Rose?
Okay.
You know which one that is, don't you?
Yes. Is that okay there for a minute?
Thank you. I've forgotten how bad it tastes. Like you, I'm a dental virgin. Okay, that's all right.
Okay, so I'm just planning where I'm going to put it. I've orientated the needle already. Just under the mucosa. There we go. Is that okay?
That's fine. Excellent. Perfect. Didn't feel that at all.
Ready?
Yeah, very good. Didn't feel that at all.
I was really nervous. Could you not see my hands shaking as I was doing it? I was thinking, oh God, I'm going to stick it right through his lip or in his nose or something. But it was okay.
As a rule of thumb,
It's a good start for Rose, but she needs to get out of the classroom and into theatre. Only real patients will count towards her assessments. During the week, Rose has to stay in London. At the weekend, she gets 2 days at home in Portsmouth.
I reckon that's all the flour you need for 12 cakes. Surely not. It's quite nice to be a normal person sometimes. I suppose you do miss being at home and coming home to your own kitchen and your own fridge.
It's precious time spent with her fiancé, Adam.
It's little bits of time that you don't get to spend together that we both really miss. Just sitting on the sofa, you know, cuddling up on the sofa and watching a bit of television, having a giggle, doing the shopping together, sharing the things that aren't particularly enjoyable but are much more enjoyable when there's 2 of you there, just to, you know, be silly and, you know, enjoy each other's company.
In their first year of surgery, our trainees are expected to get into 120 operations. Every operation counts. If they miss out, they will fall behind. Anita made a serious slip in a skin graft operation and had to take some criticism.
I think I've got quite a lot of motivation, enthusiasm. I want to learn and I want to do better, so I don't mind being criticised in the way I do things because it's constructive in order to improve. I'll get there eventually.
But she still wants to get into plastic surgery.
Hi Sam, my name's Dr. Mohan.
She needs more practice. Today, Anita's in hand clinic with her consultant, Mr. Ahmed.
In hand surgery, there's lots of sort of small and they can be quite intricate operations, and I quite like that. Just tell me what happened.
I sliced my hand with a Stanley knife, like a cross from here. It's gone numb, sort of like there.
So where does it feel?
One of their first patients, Sam, needs to have his nerve repaired. It would be an ideal operation for Anita.
With Sam's case, I haven't seen like nerve repairs before.
The sooner it goes to theatre, the better. So Mr. Ahmed starts the operation. It's a great opportunity for Anita, but she has other patients to see first. Will she get to theatre?
Can I have a look?
Yeah. Anita, it's very important for see what exactly the damage and what we talked about it, so in real life she can see this patient.
And ended up breaking my thumb.
The trainees will be judged on how many operations they attend.
Okay.
Or the joint as well.
But it's a busy day in clinic. By the time she's finished and changed into scrubs, it's too late.
You have to really make a big effort sometimes, try and get yourself into theatre, but sometimes it's just not possible. It's a shame, but unfortunately that's one of the stresses that goes with the jobs.
Anita has missed this chance. The pressure's on to increase her experience in theatre if she's going to be good enough to get a plastics placement next year.
It's really tough as a trainee to get surgical exposure. It's really tough. There's a huge amount of pressure put on them. We've all been through it. We've all done it. It's tough.
Smittesh missed out while more senior trainees got opportunities in theatre. But today, his supervising surgeon, Mr. Nicola, thinks Smith has earned his turn.
I hope to be able to do the operation on my own, really, from start to finish. So this is quite a big deal, really.
He'll remove metal pins which held a broken arm together whilst it healed.
A procedure that's often underestimated. It can be the most difficult of operations, more so than putting the stuff in the first place.
There's no real simulator for the way tissues feel when you've got them in under the scalp or when you've got them under the forceps. And that's only something that you get from doing operations and getting stuck in like this.
This is the first of the wires coming out. Good.
Get a shot there. Satisfying. So, shot.
He's made it look straightforward and easy, but believe me, I've seen lots of people try and remove these, and things haven't gone as well as you would expect.
I was able to do the whole thing from start to finish, which is fantastic, which is basically the whole aim of becoming a surgeon, isn't it? So it's nice to say that I've sort of moved up another level, if you like, another notch on the training belt, I suppose, yeah.
Smith's finally got valuable operating experience. He's back on track to pass the year.
Very satisfying, yeah. Good to do. Can't wait to do the next one.
It's 5:30 in the morning. I've just woken up and I have to go to work now.
On Monday mornings, Rose has to head back to London. She's getting more training for bigger operations in jaw surgery. But the last time she used these tools, she was putting up a shelf.
We share the DIY in my house, actually. I'm the assistant. It's much easier without the rest of the patient attached to it.
Today, Rose will be involved in a major jaw operation.
Hello, Billy. Hi there, my name's Rose.
Billy's jaw isn't normal. The upper and lower jaw grew at different rates. She needs an operation to fix it.
Nervous. Petrified. I'm just scared of the pain.
It's Rose's chance to use her new skills.
Ready, steady, slide.
She'll have a leading role, screwing the metal plate into the jaw to hold it in the right position.
You're so focused on what you're going to do, you're not thinking about, I'm going to drill into this person's face. You're thinking, right, I'm going to drill a hole and then I'm going to put a tiny little screw in it and I don't want to drop it and I don't want to drill in the wrong place and that kind of thing.
Her consultant starts by breaking Billy's jaw.
Yeah. Right, Rose, up to you.
Because you want to back in it, straight in and out. Keep the jaw running. Good, fantastic.
When I'm at work, I love it. I genuinely have moments when I'm at work and I think, I can't believe I get paid to do this.
The screw goes in the same direction, obviously, as your jaw the whole.
And I don't know anyone else who enjoys their job as much as I do.
No. Good, excellent. All the way home.
The operation is a success. It's a valuable experience for Rose.
It was good. I'm a bit sort of achy and I want to drink and I want to go to the loo, but other than that, I'm fine.
Honor did well with a pregnant appendicitis case and in keyhole surgery.
Okay, yeah.
Now, his consultant has made him responsible for the care of a very special patient, both before and after her operation.
Hello, Mrs. Hughes. Hi, my name's Honor. I'm one of the junior doctors. I work with
Yvonne has one of the rarest types of liver cancer, affecting only 2 in every 100,000 people.
And you're a nurse, I believe.
I'm a health visitor.
She's having a massive operation which carries a high risk. There are often serious complications. For consultant Mr. Zhao, looking after these critical patients during recovery is an essential part of becoming a surgeon.
It will be very important for Honor to learn this part of medical training because sometimes I personally feel it's far more important than performing surgery itself.
Are you feeling okay?
Yes, I feel fine. Yes, it's been nice to get it over and done with.
I've met Yvonne now, getting to know her slightly, you know, just even in that brief period, and you start to really appreciate that you're treating a person, not just a disease.
So what we do is, first thing we mobilize the liver, okay?
In a 3-hour operation, the team removed the cancerous left half of Yvonne's liver. Honor gets some more theatre experience, but it's only when this operation finishes that his real work begins.
I'll be one of the first people to see her when she comes to. And yeah, I'm looking forward to telling her the operation went well. And I'm looking forward to, you know, caring for her and her getting better.
Yvonne's recovery does not go as well as Honor had hoped.
I just feel so exhausted today.
An infection sets in, which her tired body has to fight.
Yvonne's, you know, a very dynamic, amazing lady. It does upset you when you see that, you know, part of that has gone. Well, I'd like to think that I treat my patients like I would any member of my family. If it was your grandma, you know, what would you do? Yeah, no matter how kind of busy you are, how tired you are, just always sort of keep that in mind. So hopefully we'll start to see a bit more of a rapid recovery over the next few days. She is worn out at the moment.
Honor's done all he can. Now he'll have to wait to see if Yvonne can pull through.
Position evaluation.
The best jobs next year will go to those who do best this year.
We are aiming to provide the United Kingdom with the very best surgeons.
With just weeks to go before their final assessments, every patient is a chance for the trainees to give themselves a competitive edge. Anita's hopes of becoming a plastic surgeon were knocked when she made a mistake in an operation. That patient, Jane, has come back to see Anita. She's recovering well.
How are you yourself? Fine. She's getting a bit of her life back and she can get out a bit more, and I think being able to do something like that for someone is really special, and I think that's one of the great advantages of surgery.
Now, Anita wants to prove she has learnt enough to do these delicate operations herself. Today, she might get her chance. When she was a baby, 7-year-old Halima was in a fire. She still has a nasty bald patch of scar tissue on the back of her head.
It's a chance for me to do some operating. It's always good to see and learn, but it's more fun for me when I get to actually do things.
Anita's consultant is giving her the chance to remove the scar so that Halima's hair can grow normally again. Miss Timoney will judge Anita's handiwork.
If we can aim to perhaps get rid of that area.
At Anita's level, it's important to get her concentrating on the detail of everything she does.
Thank you.
Should I just go straight across? Yeah, go straight across for now.
You're working to actually fix something. You've got a problem and you're working together to try and fix the problem. And I love seeing that.
Probably you just have to do it by feel. Always use the single hook.
Yeah,
like a
just
skin
to
hook.
turn it over.
Yeah,
the
you
edge
can
over.
hold it.
Getting Anita to get the right habits sort of at this stage, stitching wounds, it means that when she moves on to something a bit more delicate, she won't have any trouble.
It's a landmark for Anita. She's done a good job in a delicate plastics operation.
That was really good. It's very exciting, and it's really good for me when I get to be more involved in the procedure. I hope I've made some progress in the way I handle the instruments now. I'm less sort of shaky and thinking about, oh, what am I doing? I just get on with it. So I think I've made that progress.
So she's come a long way. She's very competent to do the essential surgical skills. She just now needs to practice that a lot.
It's a much-needed boost. In just a few weeks, Anita faces her final assessments. Only the best will get a plastics placement next year. After 8 months training, Rose should be tackling bigger operations and getting more experience. Instead, she's packing her bags and leaving London.
I thought quite long and hard over it. I think you can't just live to work all of the time.
She's struggled living apart from her fiancé, Adam.
I've probably learnt the hard way that my personal life is more important to me than I thought it was. But I think this is the right decision for me and for Adam as well, I think.
Rose has decided to train closer to home. She's quitting one of the most renowned surgical schools in the world.
It's got some of the sort of biggest teaching and best teaching hospitals, certainly in the country and possibly in the world as well. And it's difficult to think you won't be part of that anymore.
She's our first trainee to quit the course. Honor has proved himself in theatre. His consultant wants him to get experience caring for patients after their operation.
How are you feeling? Yeah,
He's been in charge of helping Ivonne recover from a serious liver operation.
I will be back to see you a bit later on, okay? All right.
It's taken 3 weeks.
So we're going to see Ivonne now, and she should be going home today, if all is well. And she's having breakfast and putting on some cream, so good sign. Hello. Good morning.
Good morning. I'm just making myself beautiful.
You look back to your old self, really, like back to, yeah, exactly back to that first day when you came in.
Yes, yes.
It's really good to see.
No, I feel remarkably good.
Well, it's been an absolute pleasure. She's back, you know, you can see, speaking to her, she feels as good as she did before, and that's, you know, so lovely to see. But
Well, all the best.
You too.
And all the best in your career.
Thank you very much.
Honor has been there, you know, at the forefront all the time. You know, he feels like a friend almost.
Hello, good morning.
Good morning, Mr. Jones.
How are you?
His consultant, Mr. Zhao, has been watching him at work.
Honor did extremely well. I think he has a very important role post-operatively. I'm very pleased.
It's another good mark for Honor, who started the year as one of the top students. But this experience has reminded Honor that there's more at stake than personal ambition.
I mean, this is the kind of great part of the job. It really is, being able to connect with people, like looking after them, caring for them when they kind of like desperately need you and when they are unwell, and then seeing that that care results in them getting better. And yeah, it's amazing, and that's why I wanted to be a doctor, like, let alone be a surgeon. It's why I kind of always wanted to be a doctor.
As the year comes to an end, the trainees face their greatest challenges yet. The operations get bigger and tougher, they make life and death decisions. And when it comes to the final examination, who will pass and who will fail?
I don't know if I'm going to fail or not. There's a lot of people that have failed already.
A little bit nervous.
Come take a seat.
Some of them are failing.
These 10 have been chosen to be our surgeons of the future. They've read the books, they've learned the theory, but now the practice is over. As trainee surgeons, they'll get to operate for real.
Just a bit nerve-wracking.
Nervous.
Over the next year, we'll follow them as they get to grips with real patients. From toes to tonsils, they'll be operating.
Bit tense.
And it could be on you.
Is there any such thing as an average day?
The fear that everyone has is you're actually not cut out to be able to do it.
They've just 12 months to prove they've got what it takes to be a top surgeon.
Welcome. Congratulations on getting this far.
This select group have already studied for 5 years to become junior doctors. But if they want to become top surgeons, they'll have to start all over again.
You are the bottom of the pile. Sorry.
It is extremely hard. I think you've got to make a lot of sacrifices. You know, you're starting from a very low level.
I think you have to be quite determined. I mean, it's a really competitive field, so you have to know that you want to do it and want to be the best at what you're doing.
2,000 doctors applied. Just over 100 were chosen to become the surgeons of the future.
You're being compared to everybody you work with, and nobody wants to come out at the bottom.
If you are not good enough, we will fail you.
Only a quarter of trainees will stay the full course and make it to consultant. As junior doctors, most of their surgical experience has been on foam rubber tubes and dummies, but from now on, they'll be doing it for real.
I'm excited. It's going to be a good year. They're really battling it out to get to theatre.
This episode, we follow 4 of them. Training won't take place in classrooms, but in busy London hospitals.
And have you ever been to hospital before?
Take some breaths in and out through your mouth for me.
They'll be expected to get into operations whenever they can.
Any pain in the knee at the moment?
But caring for patients must come first. It's a job 25-year-old Rose loves.
Does anything make it better or worse? I wouldn't describe myself as more caring than the next person, but it is important to me when I see a patient that they get the impression that I do care about what happens to them, because I genuinely do.
Now Rose is a trainee surgeon, she also has to find time to get into theatre.
But given that my bleep has gone off every 5 seconds for the last 2 hours, the chances of me getting anywhere near a theatre today are small.
But if she doesn't get enough operating practice, she won't pass the year. Senior surgeon Mr. Shri might be able to help her out.
We've got an 11-year-old boy who's got presumed appendicitis. who we're going to take to theatre now. And I've just come down to see if my SHO is free to assist in the case. Have you done many of these before, or?
I haven't actually done one.
Can we just ask them to come here because they're in a waiting room?
Fine. And have you completed your basic surgical skills and things like that?
All right, fine.
All right. We'll take it sort of step by step.
Oh, thank you very much.
I think the child has been sent for, so you should probably go and get changed into some scrubs. And meet me upstairs in about 5-10 minutes.
Yeah, that's perfect.
It could be Rose's big break, but she has only 5 minutes to juggle a backlog of patients and find another doctor who'll cover for her.
If you could look them up, that would be super. Will you ask for an incision and drainage if it's something simple, but it's fine, I'll do that quickly on my way upstairs. I'm in danger of being late for the registrar. Hi, my name's Rose, I'm surgical SHO on call.
The operation won't wait for Rose. It's already started. But getting someone to cover for her is proving difficult.
Is there any chance you could do us a quick favour? It's just I need to go to help in theatre. Hi, I'm really sorry to bother you, Christine. Are you really busy? Let's go. Okay, thanks. Bye. No.
20 minutes into the operation, and Rose finally makes it.
Sorry, Shri.
It's all right. What's the delay?
I couldn't get Ian wouldn't. Is it Ian wouldn't? Was too busy to come down. Nick was too busy to come down.
She's missed the crucial part.
By the time she had come into theatre to assist, she'd missed most of the important part of the operation, which is access to the appendix. Patients come to theatre for an emergency operation, you know, that is a priority. And so the surgical trainee needs to emphasise that to the A&E staff and say, look, I know this is important, but, you know, we've got an emergency operation in theatre that I need to be there for. Certainly she needs to be a bit more forceful with getting to theatre.
You have to get to theatre though, otherwise you'll never be in a position where you're ready to progress from being an SHO.
Hi, surgical SHO on call.
Trainee Rishi is at St Mary's Hospital.
What brings you into hospital this time?
Like all the trainees, he has to spend most of his time on the wards.
Check what have you got him down for. Is it a vein marking and also a left arterial duplex as well? When you're doing surgical training, you get so few opportunities to be taken through operations that you just got to take them whenever you can. So this is my priority at the moment. Orthopedic SHO? Cheers.
Today might be Rishi's big break, as his consultant, Mr. Murthy, has called him to theatre.
There's very little time to get these youngsters trained. So I'll make an attempt to try and show Rishi as much as possible, but you will see for yourself that it'll always be under a certain amount of stress and pressure. We don't have the luxury of time, that's what I'm trying to say.
Rishi has worked for 5 years just to get this opportunity.
I'm very excited because it's all new to me, so any sort of experience is great. So before the operation, you're just kind of thinking about what you're going to do. You're just trying to sort of go into that zone, trying to focus yourself.
Everyone agree this is a left side hernia? The mark's there. Okay, now, fine. Can I have a knife now?
His inexperience means all he can do to begin with is watch.
Give me a retractor again. There.
Okay.
I need to go the upturn pathway in your ligament.
Okay.
The edge. You with me, Shifa?
Yeah, I'm with you. I'm definitely with you.
After an hour of waiting, Rishi gets his chance to do some stitching.
So do you want to come this side and do it?
Yeah. Okay.
Quite like the whole thing of being put under pressure.
Scissors, please.
This isn't practicing on foam rubber tubes.
Pull it through once and for all.
Yeah.
His consultant watches him like a hawk as Rishi operates on real flesh and blood.
Okay. All right, Rishi.
Yeah.
That's too short, Rishi. Never cut sutures so short. Why did you do that? That's very casual.
Sorry.
So let's take one more suture here and then we're done. Nice fibrotic tissue. Don't take flimsy tissue, that's very flimsy. Rishi, pay attention. Pay attention.
Yeah.
No, Rishi. Pick the edge up. Hold the mesh, Rishi. Rishi, pay attention. You, Rishi, look at me. What you're going to do is, you're going to lift this up, look below it, place your needle accurately, make sure you don't take anything else below.
Okay.
All you want to do is take the edge of this. Good, go for it.
For Rishi, it's not a good start. He struggled with surgery's basic skills. He's a long way from doing his own operation.
You can't do an appendicectomy, you can't do a hernia operation till you're not tying and your suturing is absolutely slick.
It's been a wake-up call for Rishi.
You are under a lot more pressure, and so I think you've got to be able to deal with it. You know, do I really want this? Do I want to take all these knocks to become a surgeon?
Good is not good enough. We're looking at excellent.
In just 1 year, these novice surgeons have to get from first cuts to performing their own operations. 26-year-old trainee Nicola is at St Heliers Hospital in South London.
Hello, surgical on call. I quite often get mistaken for being a nurse. And I think, you know, some people just assume.
It's her job to see new patients arriving at the hospital.
I thought I better come up. I thought it's got to be something.
Hello, my name is Nicola Robertson, as I said, one of the surgical doctors.
She has to decide who needs surgery and who doesn't.
I've got a bleep's just come in that a patient has arrived, a surgical patient needs to be seen. He's a guy that has an abscess.
It's on Gary's bottom, and it's painful.
When did this problem first start?
Well, the actual problem at the moment was about 3 weeks ago.
Right.
It burst, but it keeps coming back every day or two.
Right.
Exactly the same. So it sort of and it sort of just builds up
And then bursts again.
Yeah, and bursts again.
What we need to do is, in theatre, have a look under general anaesthetic and open up the abscess and let it drain.
Yeah.
You pop yourself dressed to come.
Nicola's in luck. She's got a patient who needs an immediate operation, and Gary will be happy to just get some relief.
I can't sit. I can't drive properly. I really do want it removed because I'm in a lot of pain.
Mr. Gordon, her consultant, is happy to let her do it.
It's a good operation for the trainees to cut their teeth on. They're disgusting, they stink, and probably the top tip for you is to wear a mask when you go in because the smell is disgusting.
It may only be a big spot that needs bursting, but everyone's got to start somewhere.
Well, she should be able to do the whole of this herself with some guidance. You know, start with the simple ones and then move on to more complex ones.
I was always one, if someone got a splinter in their finger, as a kid, I'd always be like, oh my God, let me get that out.
Just grab the majority of the abscess, stabilise it, and then aspirate.
So if someone comes in with a massive abscess full of pus, that's, you know, the pus has to come out.
That's it.
Lovely.
Nicola's off to a flying start.
Hi, it's Rishi, surgical SHO.
But Rishi's back in the lab to practice after his disastrous operation.
To secure the knot again, pressing down there. I'm human, found it hard, you know, last week. At the end of the day, it's all about patient safety, and it's all about making ourselves better surgeons as well. So I don't think you should be afraid of, you know, making mistakes as well. It's better to make them in a safe environment under proper supervision so that when you do all your operations independently, you know, you feel very confident doing them as well.
Rishi still needs to work on those core skills, which are fundamental to surgery, any kind of surgery. He's just got to keep practicing. He's got to practice. He's got to get this perfect. He should be able to do this in his sleep.
I think you can take it in two ways. It can knock your confidence and you can think, you know, I can't do this or whatever, or you can just say, you know, look, I'm human, you know, I found certain areas that I can work on, so I'm here to improve, I'm here to learn, And you know, I think it's a good thing. I think it's a good thing to do that.
Rishi will be back in theatre soon. Will he be able to cope with the pressure and put his mistake behind him? For her last appendix operation, Rose arrived in theatre too late. Now, she's desperate to get theatre experience, but can she find a suitable patient?
Yeah, I would be really, really keen today to go to theatre if there are any opportunities to go.
Her next patient has a severe bout of trapped wind.
So as you can see, I'm all blown out here. So I'm completely blocked. If they don't do something soon, I should literally blow up.
Looking at your x-ray, it certainly looks as if the bowel's twisted again, and that's what's causing the blockage. Okay? Let's try untwisting you with the tube.
Plan A is a simple pipe insertion. If that fails, Rose will have to take him off to theatre.
Do I have very far to travel?
Rose has done well. The trapped wind has been released. It's a successful outcome for the patient. He won't need an operation. For Rose, however, it's another day without being able to get into surgery. It's a disappointment for her. She's made big sacrifices to train in London. She has to spend every week alone in a hospital bedsit. It's a long way from her comfortable home in Portsmouth, which she shares with her lawyer fiancé, Adam.
It can be quite disruptive on our sort of personal lives, and we end up spending a lot more time on the telephone, obviously. I'm here on my own quite a lot of the time, and I think Rose finds it quite difficult as well.
It does cross my mind, what the hell am I doing? I am a grown person. I own my own home, and what am I doing? Sleeping or living like a student. It's fairly self-explanatory. The bed is there, the desk is there, and the sink is there. I wanted to kind of get on the career ladder, I guess, and get some of these years ticked off. So I accepted the job knowing that it was 70, 80 miles away from where I lived. I do question whether it's the right thing to do.
The trainees need at least 100 operations to pass this year, but so far they've done very few.
Mr. Gordon's got a theatre list this morning, so if there's nothing to see on call, then we can go to his list.
And what are we hoping for today?
We're hoping for an appendix today.
It's Nicola who's in luck again. She made a good start when she lanced an abscess. Now she's facing a much bigger challenge in theatre. Her next patient has multiple sclerosis and needs a special tube running into her bladder.
There's always opportunities, and if you don't make the most of them, then you're just not going to progress that much. I'm just going to clean the tummy.
Nicola will perform the operation, supervised by senior surgeon Mr. Georgakopoulos.
Obviously, the risk is that if you don't put the needle in the right place, you're going to cause damage to the patient. It's a very nasty complication if that happens. If she gets it wrong, then I have to take over and make sure that we do the procedure correctly.
It's an operation Nicola has never done before.
She has read the books, she has seen other people doing it, so now it's her time to do it.
Give local anesthetic now.
The woman will be awake throughout the procedure. It's up to Nicola to numb the stomach.
Okay, I'm just going to give the local anaesthetic, so it's a little bit of a sting, but then that's the worst bit over with, okay?
Yeah.
Sorry.
It's Nicola's job to force a hole through the abdominal muscles and into the bladder.
Straight down. Keep going.
Yeah, keep pushing. More.
It needs skill and brute force.
You have to puncture that.
You all right?
It's not coming.
Okay, let's stop a moment.
Okay. Carry on. See if you can get it now. Press down. Push a bit harder. Push.
Am I just not pushing hard? I feel like I can't get deep enough.
It's the senior surgeon who has to decide when to step in.
It is all going, the needle, we can see it's going into the bladder, okay? So it's all in the right place. We're just gonna have one more go now, okay? You're doing really well. That's painful. Okay.
Okay. We stopped then. Take it out, yeah?
Nicola has to stop. Mr. Georgakopoulos takes over.
Sorry. Okay, that's it then. No, we have to stop. I can understand it was when you do this case and you realize that you don't get it right the first time, you may be a bit frustrated. You might start thinking, am I doing something? No, you were not doing anything wrong. When I really pushed hard, the patient just, was in pain.
Yeah. It's a funny ground because you kind of, then you see the registrar do it and just go for it and you're like, oh, I should have done that. But then you can't because you're not used to what you're doing and they've obviously done it thousands of times.
I'm hoping she's not going to be disappointed after this failure.
Anyway, it doesn't always go according to plan.
Let's get hot chocolate.
Rishi had a disastrous start to his surgical training when he messed up his stitching. Now, after practicing his surgical skills, he's been given the chance to get back into theatre.
Orthopedic SHO?
His patient, Maria, is having a spinal operation.
I've got a little hope that it's going to be a bit better, and I've got a big hope it's not going to get worse, because you never know how it goes. It's a surgery after all.
It's a complicated procedure to separate two vertebrae that are locked solid. As the operation gets underway, yet again, there is little for Rishi to do. He might get his opportunity at the end of the operation.
Judith? Oh, no.
Large clip. Oh, we've got Morris retractor.
Yeah, let's get a Morris retractor.
All operations carry a risk. Suddenly, this one goes wrong. A vessel is bleeding and they cannot stop it. Uncontrolled bleeding is the surgeon's biggest nightmare. While they stabilize the patient, Rishi is sent to get a specialist team to help.
We're going to find a vascular consultant to help stem the bleeding. You know, any of the vascular surgeons are around? Have a see. No vascular surgeons in there. I'm just going to find out from the board. It's not easy at all.
To make it as a surgeon, it's essential to stay calm in emergencies.
Oh, hello, Mr. Gibbs. I'm sorry to disturb you. My name's Rishi. I'm one of the orthopedic SHOs working for Mr. Akmal. Oh, you're outside? Oh, my goodness me. All right, that's fine. That's fine. No, that's fine. That's fine. I'll ring the vascular SPR or consultant. I'll call. Can I just 1 second, mate? We've got to bleed. We've got to bleed. It's inferior vesicle. We can't get control of it. Inferior vesicle artery. The general surgeons. It looks like it's from the inferior vesicle artery. It's theatre 2. Okay, cheers. Bye. Right, vascular's just coming to have a look now. It looks like it could be an abdominal wall, it could be inferior epigastrial.
The vascular surgeons step in and control the blood loss. The operation is back on track. Rishi has kept a cool head under pressure.
He was able to call up the right people, and I think that's really important in a situation like that where you do have bleeding and you do need some input from different teams. So yes, I think he did well.
The crisis has been averted. The vascular boys have come in and done their magic, so it's just something that had to be done.
He's done well outside the theatre, but he still has to prove himself when he's the one holding the scalpel. The trainees have made a start to their surgical careers, but they're all still waiting to get that big break, being allowed to do an operation from start to finish. 27-year-old trainee surgeon Andrew L. Rice is off to St Helier Hospital to do the early shift. He's following the family tradition.
My dad is a retired surgeon. My mum was a nurse, so you're obviously exposed to it. My dad was someone that I really idolised when I was growing up. I've heard from people that worked with him that he was a great doctor. So he's a role model for me, basically. I think my strongest side is that I feel that I really get on well with people.
How's your pain at the moment?
I'm not the most intelligent person in the world, but I do come home often and think, yeah, I really got on well with that person today.
It's time for the weekly ward round with consultant Mr. Thomas.
We're going to examine him for us, Andrew.
Listen, what's brought you into hospital?
What question haven't you asked about the vomit?
What
Not only what colour is it, is it digested food or not?
Yeah, what does it look like?
Brown, like beer.
Like beer. Fairly intimidating when your boss is around as well, because obviously everyone doesn't want to look silly in front of them.
We think that it might be because there's not enough blood getting to the bottom end. Can you just lift your head up for me?
Mr. Thomas keeps a close eye on how his trainees are coming along.
Things should get better from here on in, all right?
His ward care is improving. He's getting more confident. He's getting more confident dealing with patients. In terms of his technical experience, he's had very little experience. He's got to make the use of all the time he's got to see patients, to get to theatre within the limits of their hours.
But for Andy, this year is also a personal test.
To be honest, I haven't always wanted to be a surgeon, even up until a few months ago, because I love being a doctor, but I've never really known exactly what I wanted to do. So I hope I've made the right decision.
Andy needs theatre experience to make up his mind. Nicola had a tough time during a bladder operation. Today, she will get another chance to assist on a minor operation.
He's having a circumcision because he feels that his foreskin is too tight and it is causing him discomfort, especially with intercourse and with erections. I've seen and kind of assisted in a kiddie circumcision before, but I've not done adult circumcision.
Mr. Gordon is not just here to train Nicola, he's also here to make sure she is good enough to be allowed to operate on patients on her own.
I don't think you know what to expect until you see it or do it for the first time.
With the foreskin removed, Nicola is given the big responsibility of stitching up the skin.
So literally just from, if we just take that with the stitch or the bleeding.
Yeah, exactly.
Is that all right? Is that too
There's no room for a shaky hand in this procedure.
That's better. Oh, sorry.
You see what happened here?
Mm-hmm.
This is a cosmetic surgery, so, we don't want this to happen. So what we do, we cut this.
Mm-hmm.
You can go this way. Why don't you... Your body's all over the place around there. Why don't you turn this way, okay? And you're going like that now through, okay? Rather than coming around there and doing it that way. Okay? How do you think it went? Do you think you could do the operation now on your own without any of us around?
No.
Okay. And what about the shaking? I don't think it's anything to worry about. I think you are more likely to have a little bit of a tremor in the beginning of your operating, so I don't think it's an issue. Anyway, good.
Thank you.
Learning to deal with pressure is part of the job.
When you're doing something and you've got a consultant's eyes watching exactly what you're doing, it's a little bit nerve-wracking. But that's expected, really. I am quite a perfectionist. I do get really annoyed with myself if things aren't done to perfection. You know, I can eat things over in my head. I think everyone has those days, don't they?
Friday night in winter, the busiest night of the week in accident and emergency.
Hello there. So, what's the story? What's brought you to hospital?
It's Andy's responsibility to see all the surgical patients who come in the door.
I've just got a couple down in casualty, a little bit busy, but I'll get there. Anything between 20, 30, maybe more.
He has to decide who is urgent and who is not.
And then I've got another cholecystitis, but I'll just eyeball her. I think she's already been worked out, and then I'll come up.
It's a heavy responsibility. If he gets a diagnosis wrong, it could be serious.
Hi, is Andy surgical SOJ?
On top of his normal workload, Andy is asked to cover another department.
It's just unacceptable to drop it on me like that. I'll go and talk to the registrar. I mean, if there's no doctor, there's no doctor, and we've got to see the patients. But I think that's just completely unreasonable. But all right, bye-bye. I can't cover all the ward patients.
We need someone to cover orthopedics. I can't stay because I've been on 24 hours and they don't allow me to stay. So if you could just cover the bleep for the night, that would be very helpful.
At the moment, that means I've got all the general surgical, vascular, urology and orthopedic patients on the ward and the acute admissions here. I'm completely unhappy about it. But it happens all the time, and we're meant to be good-natured about it and just crack on, but it's not in the patient's interest, so...
Fortunately for Andy, Nicola is nearby at his sister hospital. She offers to help him out.
So I've had to come across here, which is, well, not what was planned, and it probably means a lot less sleep than I was anticipating.
Oh. How are you, Rosie?
Yeah, all right.
Are you busy?
I'm so sorry, Ivonne, but...
It's fine. Oh, and he said yes. But then they failed to tell anyone that actually he was coming.
Tell me what's been happening to you.
I woke up and the pain was
And it was there.
Rose is working on the wards.
As you're lying there now, is it uncomfortable? Can you feel it?
Previously, Rose has missed out on going to theatre. She just wasn't pushy enough.
It is a new policy of mine to be more persistent with getting into theatre. I think in the past, I've probably, for fear of offending people and upsetting everybody, not been as pushy as I should have done. And it's really to my own detriment, I think.
Her registrar, Mr. Adnan, has got a perfect hernia lined up for Rose.
The doctor checked it and not all of the whatever's in there
hernia, I don't know what has come out. There's some more that's got to be come, so they've got to open me up.
So what's going to happen now is once theatres are ready, we'll take the patient up, we'll go into theatre. If Rose is free, she can come and give a hand, she can even do the case. But if not, then we'll just carry on. We can't wait for Rose, unfortunately.
It will probably be quite a nice opportunity for me if I can get through the patients before he bleeps me to go to theatre, otherwise I'll miss it.
Do you think you're going to manage it?
50-50 at the moment. Is it painful for you?
It is a matter of trying to organise yourself as much as you can.
So, excuse me, I'm sorry, this one.
The difficult thing is what you don't want to do is when you're rushing things to start cutting corners. But Rose is not someone who's going to do that.
With only 2 patients left to see,
He's in A&E in room 18.
Rose is standing up for herself.
Actually, I've managed to do some delegation, so the house officer is kindly going to see 2 of the patients that we've got to see.
She's got a junior doctor to cover for her.
I've done so many on-calls now where I haven't got into theatre. I'll get changed and then at least I'll look as if I've been to theatre. Hello?
Mr. Adnan's come down to the wards to hurry Rose up.
Could you just ask the house officer to do it? There's a house officer on till 9.
It's got 15 minutes. So I'm going to go up so they can start the anaesthetic.
No, I don't,
And hopefully
I'm afraid.
Rose can follow us up.
Bye.
I'll go up.
Would it be possible, do me a huge favour, get someone to take some blood from her? Lovely. Thank you very much. With every bleep, my hernia is moving further and further away. Okay, no worries. Bye. Dear God. Oh. Once I'm going through that door, I'm not coming out again until the operation is over.
She's here for now. How long she stays, we'll find out.
1, 2, 3. How long do you take the arm as well?
Everything's ready in theatre. Rose has a basic hernia operation, and Mr. Adnan is happy to let her do it.
You all right to crack on? Yeah. Off you go.
Let's have a look at this.
Now it's just down to Rose. Has she the confidence to do it from the first incision through to the last stitch?
Happy?
Mm-hmm.
What are you going to do now?
Put another couple of stitches.
Yeah, brilliant. Well, Rose has done the operation. I've just been assisting her. No, it's her operation.
After an hour and 10 minutes, Rose puts the final stitch in. She's done it.
Good, well done. Rose did very well.
Your eyes. All done now, right?
It was an operation that I did most of by myself, so that was good. Even though it was only a little short operation, it was mine, and it makes you on call about 1,000 times more interesting. Now, I hope I'm a lot more assertive, and that's something I've probably learnt the hard way in this 4 months, but I've learnt it now, so that's okay. Right, now I definitely need to go and appease A&E before they explode, I think.
Andy has followed the family tradition and gone into medicine. But it's only recently that he made up his mind to follow surgery. The time has come to find out once and for all if it's really for him. Today, he's been given an outstanding opportunity, a complex toe amputation.
Nervous. This is significant for him actually doing it himself under supervision. We'll see how he gets on.
You cannot learn surgery from a book. We learn all the principles, but It just doesn't apply in the operating theatre unless you've got the hands-on experience.
I think the only way to learn a practical skill is to practice it. So whether you be a plumber or a carpenter or something like that, you can't really teach these sorts of skills all the time on blackboards. Can I have the saw, please?
The critical moment has arrived for Andy.
Discuss previously, go through at right angles.
What probably really impresses upon me is the fact that there is an immense amount of trust there between surgeon and patient.
That's it. You heard the difference when it went through. There we go. Perfect. Okay. Now that's going to come together nicely, and the end result will be you'll have to look at the foot carefully to see what's wrong. There's just going to be a toe missing. You must admit that does look nice. It does. 9 out of 10.
A bit sweaty,
but
yeah, thought it
sure
went
you
all right.
should have that on the other foot. Very well, I think. I think most trainees, more senior trainees, would be pleased with how that one went.
I'm very pleased, you know, but it's important to never become too self-satisfied, I think, because that's when mistakes happen. So that's why, you know, I'm overjoyed, but I've got to, you know, keep a lid on things and reality check.
It's a milestone for Andy. Is surgery for him after all?
Can I have a little look at that? Stick your tongue out for me.
Nice deep breaths.
All our trainees are coming to the end of their first 4 months. Rishi struggled with his stitching at first. He's mastered new skills.
It looks neat. It looks very neat. I'm really, really happy with that. I'm really chuffed. Felt like I was on the first steps of being a surgeon today.
Andy's become more certain he wants to follow in his dad's footsteps.
From what I've seen so far in medicine, it's the one thing where you can really make a difference to people's outcome. And sometimes you don't get that in the other specialties, so for me it feels right.
And a new confident Rose remains enthusiastic.
You have to find it interesting, otherwise I don't think you'd bother to turn up and do it at 4 in the morning and do it on a Sunday and that kind of thing.
Hi, it's Nicola, surgical.
Perfectionist Nicola has had some difficult operations so far. She's had to take some criticism. Today, though, she's got a chance to redeem herself by removing an appendix. It's the one operation all the trainees want to master from start to finish. Nicola's patient D is as ready as she'll ever be.
I was scared because I don't like to be put asleep.
It is a great opportunity. I would love, I mean, if I can do it and do it, I would be very happy. It gives you that little bit of confidence that you can do the operation.
Mr. Wazir will keep an eye on Nicola. He'll have to step in if she can't manage.
Are we okay to start?
Maybe start.
Yes, thanks. Now there is scalpel fascia.
Yeah, that is good. Right.
There we go, that's the edge.
What you need to do is to mobilize
Yeah, I
the
can feel the appendix, exactly. So I'll just do a couple more ties. So we'll just tie that off.
Made it sure that there's no...
Tie that off here.
Others there. Okay. Very well. So far good. Now we just need to close it.
Okay.
Good bikini scar, nothing to see. Very good. She knows all the principles, she just needs more practice.
We did an appendectomy today.
Did you?
Yeah.
Did you do it?
Yeah, I did most of it, didn't I?
Did you? Honestly?
Yeah.
Good work. Well done. Good stuff.
The day after, and it's time for the ward round. Her consultant, Mr. Toomey, wants to see for himself how her appendix patient is doing.
She'll be fine.
Go on, Nicola, you know this lady. Go and say hello.
Okay. Okay. So, hello, good morning.
Good morning.
How are you feeling today?
Yeah, it's a little bit sore, but absolutely fine myself.
Great. It was quite a nice, straightforward operation, and hopefully that's this all sorted for you, and now you're on the road to recovery.
That's good.
Have you got any questions at all?
No, I just want to say thank you very much for looking after me and taking care of me.
That's a pleasure. Okay.
Thank you.
All right.
So how much did you do?
The only thing, well, Mohammed was showing me how to do the purse string, and then there was one tie that I wasn't quite happy that I got it tightened up, so I asked Mohammed.
So did you do it all with skill and panache?
No.
Feeling of confidence throbbing through your veins throughout?
It was actually really nice
Or was
to do
it white knuckles? It's all right to be white knuckle at this stage. You should be white knuckle at this stage. If it isn't, we'd be a bit concerned.
Yeah, I mean, at the end of the day, everybody's got to learn. So, you know, as long as they know what they're doing, no matter how old you are, young or old, yeah, you've got to start somewhere and people learn new things every day. It should be fine. She's okay.
We follow our trainees as their year gets tougher. Is Anita good enough to make it as a plastic surgeon? Rose gets the shakes injecting her new boss. And Honor faces a tough decision when a pregnant woman needs an emergency operation.
The fact that she is pregnant, it's not something that you're going to undertake lightly.
These 10 young doctors were chosen to be our surgeons of the future. They've had just 1 year to progress from novices to performing their own operations. As final exams loom, the trainees need as much operating experience as possible.
It would have been nice to do it, but we're not going to force anyone into doing it just for the sake of me practicing.
With just weeks to go, every operation is a chance to give themselves a competitive edge.
I don't know if I'm going to fail or not. There's a lot of people that have failed already.
A little bit nervous.
Come take a seat. We feel that you're probably not in a position where we can allow you to progress to next year.
For some, it won't be enough. Not all of our trainees will make the final cut. "26-year-old Nicola Robertson spent her first months in training taking some knockbacks.
Oh, sorry. I do get really annoyed with myself if things aren't done to perfection.
She eventually got to do her own operation, which was a big success.
Okay. Yes, she's okay.
It's 6 weeks before her final exams, and Nicola has been in 90 operations. Like all the trainees, she's desperately trying to reach the surgery school target of 120.
Now I'm coming to the end of my first year of training. I'm at the point where I like to do as much as I can. So hopefully, fingers crossed, I can do some today.
This morning at Epsom Hospital, the theatre's busy. It's a chance for Nicola to add to her numbers.
Are you all right if I just examine the hernia before we do the operation?
If Mr. Smith is happy, that is.
So hopefully that will be a nice, simple operation, and we'll repair that for you today.
Right.
All right.
Are you going to be doing it?
I will be involved in the operation, yes. If that's okay with you, sir.
Yeah, fine, yes.
I didn't want to terrify him, so, yeah. And the patient has to be aware of whether you're going to be involved or not, but he seemed relatively happy.
So the patient's willing, but now Nicola has to convince her consultant, Mr. Zaidi, that she's capable of doing it.
Would I be able to kind of try, because I've obviously seen him before.
You can do skin to skin if you're confident.
Thank you.
When surgical trainees asked to do a procedure, I think that means that they are feeling confident, which is a very good thing.
I haven't done one before, so if I can do this, then that is good news.
Now she's persuaded her consultant to let her do it, the pressure is on Nicola to perform well.
Is it okay to start? I am quite determined. If I know I want to do something and I set my mind to it, then I am very determined. And I just want to go under that. But I can be quite apprehensive and I do doubt myself. Can I just do it with artery forceps? Yeah,
She gets to do the operation from beginning to end.
Okay. Good.
Thank
Well,
you
that was
very
good.
much.
Yeah, it's all right.
Nicola's learning that being pushy can get her the operations she needs. But with just weeks to go, will it be too late?
So even though I really enjoyed doing that, and it's really good that I've done one for the first time, I almost wish I could just do it again now.
When she applied for training, 25-year-old Ivonne Umabwani found out she was one of the year's best students.
I was quite surprised that I was in the top 10%, because I actually thought I'd fail being Sam. And then I thought, I better not say anything, because soon I'll get an email saying that actually we made a mistake, but no, apparently so. Apparently it was true. Are you still drinking lots of water?
Yvonne's mum and dad are from Nigeria, but she was brought up in Cheshire.
Good. My parents are quite proud. They say, oh, my daughter's a surgeon. Everyone goes, oh, wow.
All right, thanks, bye.
Yvonne's got only one ambition, to become a plastic surgeon.
Plastic surgery is well known across the world as being one of the most competitive specialities in surgery to get into. But that's what I want to do, really. So I have to kind of just make sure that I keep myself at my best to put myself in the running. But even then, it's not definitely guaranteed.
But for now, she's at King George Hospital, in the less glamorous urology department, dealing with the waterworks problems of elderly patients.
How's your flow?
Very weak. It's not very strong at all, not like it used to be. And I thought it's just my age.
Yeah.
Well, I'm only a youngster, really.
Exactly.
21 next birthday and all that.
Oh, I'm older than you. I'm not a urologist, even though I've done 8 months of it.
Maybe you want to go to the top.
I'm a girl. Most of the patients are male, and old men as well. They get extremely embarrassed by the fact that they're having a female examine them. So I need to examine your prostate.
Okay. Oh, you're not going to do it, are you?
I am.
Okay.
I don't necessarily want to spend all day, every day, knee-deep in wee or sticking scopes up people's willies.
I'm up all night. I never hardly sleep. This pee, and it drives you mad.
I enjoy doing it because it's given me a lot of skills, but it's not something that I'd want to do for the rest of my career.
Yvonne will have to find a way to reach 120 operations to give her any chance of becoming a plastic surgeon. 26-year-old trainee Nick Antonopoulos has come a long way to become a surgeon.
I grew up where I still am, actually, in a council flat in Wood Green. Not one of the best areas. Didn't go to a very good school. My school actually got closed down after I left because of bad GCSE results.
Okay. I'll come as soon as I can, yeah.
It's
All right.
spring.
All right, bye.
Nick and the team at Queen's Hospital are dealing with gardening enthusiast Ken.
It was a nice day, so I decided to cut the grass and got me fly mower out the shed. I'll go a bit mad with it now and again, sort of thing. So I pulled it across, and of course the blade's gone round. And the rest is history, really. As I just say, it was just blood coming out, run indoors, called up to me daughter, get an ambulance. I think I've chopped me toes off.
I'm going to bring you in.
Okay.
One toe needs stitching, but Ken might lose another. Nick and the team will try to save it if they can.
Gardening's a dangerous thing.
Originally, when I was at uni and med school, I didn't want to become a surgeon at all. I was quite offended by the whole notion of surgeons. Didn't like them. I thought they were very arrogant, rude. I hated them. And then I was in doing a surgical rotation, and the registrar then was like, "Oh, you'd be a really good surgeon. You should be a surgeon. You really think surgically." And I was like, I got really annoyed with him. I was like, "We're trying to say I'm rude. What?" I thought I was being quite nice to him. And when I started working properly as a doctor, my first job that I ever did was surgery, and I really liked it. And I thought, okay, yeah, I could do that.
It's Ken's lucky day after all. He gets to keep all his toes.
Yeah, very nice. Nice to see that. I mean, it's quite a common, straightforward type of thing, but I'd never really seen it before, so it's good to see it firsthand.
And for Nick, it's another new operation to chalk up in his logbook.
Introduce ourselves.
They were chosen from 2,000 applicants for one of the toughest surgical schools in the world. But to stay on course, they now have to pass the first year assessments. The first hurdle is the practical exam. If their surgical skills are not good enough, they will be asked to leave the course. Some are closer to failure than they think.
But please remember,
as head of the School of Surgery, Professor Stanfield helped choose these trainees. He will judge their performance on the number of operations they've been to.
We're looking for them to be involved in approximately 120 cases per year. The trainee who does best is the trainee that elbows in. The trainee that does really well is the trainee that's always available.
Ivonne wasn't that keen on looking after old men in urology. Now she's moved into general surgery, she has a chance to chalk up bigger and more complicated operations.
I'm constantly fighting to get into theatre, so even when it's not my theatre day, I will still go in and say, "Oh, can I do that appendix?" or "Can I do that hernia repair?" I'll be the first person to scrub up, but I'm always wanting more.
Her registrar, Chris, is impressed.
Yvonne's prepared to put the extra hours in. She has been to extra theatre sessions, and if there's something going on, it's not a case of waiting to be invited to do something. She's always asking, "Can I do this?" And that's the sort of thing that you need. You need to put yourself forward.
Today, she's getting to do a major procedure.
Someone that needs to have his above leg amputation. So I've not done one of those before, and it's me in the reg. So tally ho. Chris, am I going to get to do much of it?
I don't see why not.
There you go.
I'm not doing all the work today.
Well, there you go. My first above knee amputation. Has the anaesthetist seen you?
Before we start, you have to speak up loud because I'm mutton Jew.
That's all right.
Charles has very bad blood circulation in his leg. He's had to make a tough decision.
Well, I talked it over with my family, my wife and my son, and we thought it would be the best. But it's not going to get any better.
Yes.
How many of these have you seen? None at all?
No.
Okay.
I know how to do it theoretically.
Fair enough. Let's see if that theory is the patient asleep. Query trip.
She hasn't done an amputation before, but Yvonne has bags of confidence.
I do feel, as long as I have guidance, then yeah, I think I'm pretty competent to do it. I know the basic skills of surgery, so if I do get the chance to lead, then fantastic. By being a surgeon, you do need to have that determination. I think that I have a side of me that is extremely determined. I strive to excel, I am competitive, and I want to be at the top of my game. The job that we're doing, we're cutting people open, we're taking out organs. Who would want a surgeon that isn't able, who wasn't that focused or determined or knew exactly what they were doing? You don't want someone just to be kind of slapdash about it.
It's an operation that hasn't changed much since the Battle of Waterloo. Yvonne's first leg amputation has gone well.
Yeah. It's pretty awesome. I like big operations. They're quite fun.
I think she's doing all right things. She's very capable. She's very keen. She's always hanging around in theatres, and I think she's got the right mentality to survive in this job.
It's lunchtime. No breakfast, no lunch, and I've still got a million patients to see. So it's a start to the day.
In just a few weeks, Ivonne will compete with the other trainees in the final assessments. Only the best will get a plastics placement next year.
Surgeons are an interesting breed. They represent every different type of personality that there is. But the two things that really do make them stand out is that they are very hardworking and they're able to make a decision. Because, of course, when you make a decision to operate, you actually have decided that you are going to put knife to skin and open that patient up.
Nick's short of operations, but this evening he's starting a night shift where he could get a late emergency operation.
There's a good chance we might get some tonight when it comes up, because there's so much on the list now. There's a good chance there'll be some left for us to do. So we'll see.
Calm, Nick. I'm one of the doctors here. Tell me what's been going on.
I've been having this bellyache.
How long's that?
First patient of the night is Carl. He's got all the early signs of appendicitis.
That's it. Make your tummy nice and soft for me. Well done. You fan of the football?
Yeah.
What team you support?
West Ham.
West Ham. Oh, you're brave.
Let's go.
Someone has to, eh?
Nick's always wanted to be in medicine.
From the beginning, it was my sister. She's 4 years older than me. She's mentally disabled quite badly. And I was always like, oh, don't worry, I'll get older, I'll become a doctor, I'll fix it, it'll be fine. Which obviously is a lot beyond anyone, but that was when I was young, that was always the idea. From very young, like 4 or 5 years old. And then it was always like, oh, Nick's going to become a doctor. Everyone's calling me Dr. Nick from like secondary school, and it was just, I don't know, I didn't really even think about it. It was almost like that was always how it's going to be.
For now, Carl will be kept under observation until the morning. It's 10 o'clock. Nick has to find a case soon because after midnight, the theatres only take life-threatening operations. Nick carries on his search.
Ever had anything like this before?
Never, no.
When's it need to be prescribed? Because it's going to be a while, we're very busy. So that was all Monday night?
Yeah.
So now it's Wednesday night?
Was stayed in bed all day yesterday.
Okay, I'll come round as soon as I'm free. I'll come round.
Okay.
Okay.
Hopefully tonight it won't.
Just got your details on it. So that's your name, obviously. That's the surgeon who's responsible, the consultant, Mr. Coker.
A late admission, Christian definitely needs an appendix operation.
Just need your signature and your name there.
It's perfect for
Any
Nick,
questions? So we'll see you shortly.
Okay.
All right.
but it's late and it's not a life-threatening condition.
All right. So we'll book him in, but it'll have to be tomorrow now, won't it?
Yeah.
Tonight, Nick's run out of time.
Because it's very late now, it's like 1 in the morning. Well, we'll be done tomorrow morning instead. Okay?
All right.
It's a few hours away. All right?
All right. Cheers.
So we'll see you tomorrow.
Yeah. Thank you.
Yeah, yes, yeah. It would have been nice to do it, but we're not going to force anyone into doing it just for the sake of me practicing. I mean, the patient comes first and he doesn't need to have it done now, so we'll wait to a more appropriate time for him.
Nick's been unlucky, but he can't afford to let operating opportunities slip by. It's a nervous time for all the trainees. Today, they are taking the first end-of-year assessment.
I just was trying to figure out something.
They're repeating a practical test, which they all took at the start of the training year. To pass, They have to show that their surgical skills have improved. The trainees face 6 different tasks. Last year, Nicola didn't do well.
Right, okay, just go in.
One of the tasks is to stitch up foam representing a section of bowel. Nicola's nerves got the better of her.
Yeah. I want to do... Oh, no, hang on. Sorry. Oh, sorry.
Oh, the other way. No. That's the free end, isn't it?
Yeah.
Her suturing was amongst the worst of the whole group.
No.
Practice at home every night.
Every night.
You don't want surgeons that can't tie knots.
She isn't looking forward to doing it again.
The suturing one always gets me just because I get nervous under this kind of pressure. If I do badly in this exam, I could potentially fail the year.
They have just 8 minutes for each task. It's Nicola's turn to do the stitching.
Hello there.
What you're doing, where you want to place the stitches and how you're going to construct it.
What I do is I'd start with, you're working extramucosally.
Nicola asks us to stop filming. But what did the examiner make of her stitching?
Compared to the other trainees today, I thought it was probably just slightly below average performance.
Last year, Ivonne excelled in these tests. To get the top job she wants, she needs to do well again today.
I came top 10% last year, so I'm quite worried about there's nowhere else to go now apart from staying there or going down, so I'm a little bit worried.
Yvonne's technically very confident. The attention to detail wasn't quite right, though.
I don't know if I did better or worse this time round. It's essentially the same as last time, but I don't know if I've done better or worse.
Nick's not showing any nerves.
I'm feeling relaxed about it, I'm not too bothered. Get it done, get out of the way.
Hello.
Hi there.
Andrew Ballarat, take a seat.
Thanks.
But his stitching is inside out. Not a great start.
Do you always put your knots on the inside?
I should put them on the outside. Well, no, thanks.
Will he do better in communication skills, where he has to break bad news to an actress?
Do I know her name already, or...? Presumably I do. Ask you. Okay, so I haven't met you before? No. Okay. Hello there. My name's Nick, I'm one of the doctors here. What's your name?
I'm Maria Davis.
Maria Davis. Hi, Mrs. Davis. I'm
not Mrs. Davis. Just call me Maria.
Just call you Maria. Okay, fine. Well, I'm Nick. Nice to meet you. You were treated for the breast cancer a few years ago. I believe everything was going fine until now. But unfortunately, it looks almost definitely that this is due to the cancer spreading.
Given you must see people like me all the time, you can't be exact, but what are we talking here? Years, months?
I would say we're talking years, but we're not looking at very many years. I wouldn't say decades, certainly less than that.
I have 2 children.
Yeah. It's going to be difficult.
They're only 6.
6 and 8, yeah. I mean, unfortunately, that's just how life goes sometimes.
I beg your pardon?
With the cancer thing, that's just how it goes sometimes. And
I mean, I'm sorry, I know you're trying to help me,
Yeah.
but to say that's just how it goes is not very appropriate, given I'm not going to see my children grow up. And I'm sitting here thinking, why me?
Yeah, well, there's no answer to that question, unfortunately.
I'm not asking you to answer that question.
Yeah. I don't think I did a terrible Breaking Bad news. It wasn't fantastic, but that is just how it goes. I mean, I know, fair enough, I appreciate her point that, you know, it's not the nicest way to phrase it, maybe. I don't think it's that terrible. I mean, how else would you say it? At the end of the day, that is just how it goes. So, that's just how it goes.
Nick, Nicola and Ivonne will have to wait for 4 weeks to find out their results. If they haven't improved since the beginning of the year, they could fail. But this isn't just about passing exams. The trainees' focus must always be on their patients. In Charing Cross Hospital, 26-year-old surgical trainee Ed Lake is in intensive care, learning how to deal with critically ill patients. On this ward, 1 in 4 patients will not survive.
Do you get used to, I think, dealing with people just being very unwell, and also they have to try and keep positive. It sometimes sounds a bit ridiculous telling people to keep positive, but they do have to, because it's going to help their recovery if they have that. Try and keep a positive attitude.
Oh, that is absolutely spot on.
She had some platelets already.
Maureen is the most seriously ill patient Ed has ever had to deal with. She's lost a lot of blood during a major operation for bowel cancer.
The platelets were 12. She's had another pool since then, and she's had another sample sent off.
Maureen now needs a further operation this morning to remove more bowel if her life is going to be saved. Consultant Dr. Gordon is in charge.
You care for the patients 24 hours a day, 7 days a week, and you know there is no start finish. You just keep going until they get better, hopefully. So, yeah, she's been through a lot, but she's, you know, she keeps pulling through, and so we're hopeful.
Maureen's husband Michael has been by her side.
Hi there, Michael. How are you doing?
How are you?
Grand.
Should be going up shortly.
Well, yeah, I'm sorry about the waiting around. We're just trying to get her in the best state possible to take her to theatre.
Maureen will need a huge blood transfusion before her operation. It's Ed's job to organise this.
Hi, it's Dr. Blake here in ITU. We urgently need some pods up here.
By 9 o'clock, Maureen has been given 5 bags of blood and fluid.
Oh, it's almost ready.
The theatre is waiting. Ed gets positive results back from the lab.
47. Brilliant. Have you got an HB? 8.1.
Okay. She's ready to go.
I think she's as ready as she can be.
While they're breathing, there's still a little hope. Yeah.
Will Maureen survive the operation? Nicola's worried about how she did in her practical exam.
You feel like as soon as you leave, you're like, oh God, I wish I could have done it better.
It's the week before the final assessments, and she's still short of the operation total.
If I can just feel your neck from behind, if you just look
Kevin is
slightly
today's patient.
Okay, that's fine, sir.
I'm here to get this lump removed. I've had it for about 5 years, I think, but my wife finally dragged me down to get it done. And recently, a lot more people are looking at it like, well, you know, what you got there, like an alien or something right underneath it. So, yeah, it's just for my own benefit and my wife's, and just to get rid of it. It doesn't look nice.
It's another good operation for Nicola, but it's not just sheer numbers that count. It's also how much of the surgery the trainees actually get to do. If she can do it without help from consultant Mr. Thomas, it will improve her chances of passing the final assessment.
How many of these have you done before?
1.
Oh, 1. I thought you'd done more.
No.
Where have you been hiding?
I've assisted and done bits of them.
Well, Nicola will be starting it and do as much as I feel happy she can do, and I'll take over and do bits as necessary. We'll see how she gets on. If it's a straightforward one, then maybe she'll be able to do it all.
The neck is quite a daunting area to cut into if you've never cut into it before.
That's fine.
Don't want to go willy-nilly hacking around in the neck.
just do the same this end.
It is satisfying to do an operation without your seniors having to step in. You know you're kind of on the right track in what you're doing.
When you get a blackhead on your face and you squeeze it, that white stuff that comes out, it's similar to that, but a very big one.
Nicola has to cut out the empty cyst without damaging Kevin's neck.
No, I said that is the best.
Yes, I think it is.
Base of the
Good. Yes, it's all out. It's gone very well. She did 95% of the operation herself.
I think this first year is about proving to yourself and others, you know, that you've got what it takes to be a surgical doctor. It's brilliant if someone says that, you know, they think you are doing okay. They're not going to have to tell you to stop.
Nicola's reached 114 operations, 6 short of the target. It will be up to the panel to decide if she's done enough.
Hi, it's Dr. Lakecare in ITU.
It's been 2.5 hours since Maureen left intensive care.
He's back from theatre.
It's good news.
Yeah, so they've managed to save some of the bowel.
Yes.
So it's still a long way to go.
Oh yeah, he said that. Do his own.
I think it's as good as it could have been, probably.
It's a long road.
So we'll see. You can go and see her anyway.
Yeah, that's
all right. Take care.
Thank you very
No
much.
worries. That's all right.
Hello, Mom. It's lovely to see her back again. I didn't think this morning we'd see her anymore.
Despite the team's best efforts, Maureen's condition grew worse. After 3 days in intensive care, she died.
Obviously, there's some kind of professional disappointment that you couldn't have done kind of more for them, or you couldn't have helped them. A lot of people come in and get cured and go out, but there are going to be a number of people who don't make it out. I can't really remember a time when I haven't dealt with that reasonably well. I'm sure it kind of must have just experienced it a few times, and then I felt reasonably comfortable with the idea of death, and it's just one of those things that happens in hospital. You kind of just deal with it, I think.
There's some kind of abscess thing. Many thanks, yours sincerely, Dr. Antonopoulos, SHO, to Mr. Jacobs.
Nick's practical tests didn't go well. It was a wake-up call. Time is running out, and he knows he needs to improve to pass the year.
8721, thank you. I would say there's always more, where even now there's more work that I can do.
Today, Nick's hoping he can impress top vascular surgeon Mr. Jacobs and get a chance to assist in a bypass operation.
How much?
158 for 3.
For 3? They lost 3 wickets in 10 minutes?
Yes.
He may know about cricket, but Mr. Jacobs soon has Nick stumped.
Tell me what you find in this angiogram. So?
That's all right up here, isn't it?
Yeah.
Highlights there, okay.
What sort of angiogram is it? It's a transfemoral
oh, so yeah.
angiogram which was taken. Why?
For a gangrenous toe that she's got.
Which leg?
On the right.
Left. Gangrenous left big toe.
Their diabetic patient has terrible blood circulation in her leg. It's so bad that her big toe is gangrenous.
Okay, let's go.
Mr. Jacobs continues to test Nick as he tries to find a way of bypassing the blockages.
Okay, where is the vein now? Have I seen it? Have I cut it? Or is it still there, Nick? Have I cut it?
No.
And where is it? If you don't tell me, I might cut it.
Yeah, I can't see it.
You can't see it? What is that?
Ah, there we go.
There it is.
Yeah.
Come down, come down.
The blood vessels are more damaged than they thought. The operation cannot proceed any further.
No, I think it's not possible to do anything for this woman, sadly.
All Nick can do is close the wound. It's not the experience he needed. Soon, Nick will be facing his final assessment. Has he done enough?
We all want these trainees to succeed because we've been there. We've all been that trainee in their first year. We've all been that trainee taken through that first operation. We know the emotions that they're going through. And we really, really do feel for them.
Today is Judgment Day. The trainees have to attend their final assessment at the school's base in central London. At last, after a year of effort, they'll find out if their work has been good enough to allow them to pass and continue to next year.
I slept pretty well last night, actually. Thanks. Thanks for asking.
Ed is the first to face 3 experienced consultants.
Let's have a look at your logbook, if we may.
Every operation, every procedure he's attended is displayed for the panel to see.
So there's actually very little in the way of first surgeon operating in your logbook.
I just haven't.
For anything.
There just hasn't been the opportunities.
So your logbook's a bit lacking, I think. OK, could you just scroll down to the bottom for us, just so we can see the total number of operations? 47. OK, thank you. Would you mind just stepping outside for 2 minutes while we have a little discussion, and then we'll call you back in a second?
Top general surgical consultant Fiona Mint is the training programme director.
Yes, of course the London Deanery wants high standards, but it's because we feel the end product has to be of a high standard.
Hello.
We're going to award you not a 1, which means satisfactory progress, but a 2. And that means that there are specific competencies that we wish you to meet. And we're going to reassess you in March. Fantastic, thank you.
He scraped through, but Ed has to improve next year.
Was it ever in doubt? Probably for a couple of minutes, yeah.
To wear a suit to his next assessment.
That's not one of his competencies.
No, I didn't.
Where's your suit?
I'm allowed.
Ivonne was in the top 10% of trainees at the beginning of the year, but even she's feeling the strain.
I'm actually a bit worried. I think I was a lot more calm having spoken to my mum, and now I'm a lot more nervous because people are failing. People I know are failing, and that's always scary. I hope that I've done enough, but I don't know. I don't know until I get in there, really.
You all right again?
Yes.
OK, welcome.
She'll only get the plastic surgery job she wants if she's still one of the best. But in the practical exam, Ivonne has not done as well as she wanted.
So what do you think happened? So you should be at your peak of your knowledge.
I know. I think I was just slightly drained by that point from everything. I don't know what happened.
OK. All right. Let's have a look at your logbook, if we may. And just scroll down slowly.
Yvonne's made a big effort to clock up 138 operations.
All validated, well done. Anything else you want to ask or say? No? Any? So that's a panel decision, is that you have made satisfactory progress this year. So well done, you'll progress to next year. OK.
Ambitious Ivonne wanted to excel.
How was it?
It's fine, but I passed and everything, but I don't think I did well enough to get my job. I don't know. I should be happy considering that the last 4 people in front of me have had to have either failed or have had like conditional offers, but I don't know. I can only find out like next week where I am. I'm not bothered about passing. I didn't really think that I wouldn't pass, but I more want to know where I am next year.
North London boy Nick has come a long way to be a surgeon. He's next to face the panel.
Well, I mean, there's nothing to get, overly excited about or anxious about. I think kind of to give you a kick up the arse if you're lagging behind with a few things. Make sure there's no big problems that you've come across, but really you should have already addressed them by this stage, if there are. And I haven't had any, to be honest, particularly. Everything's been going quite well. I don't think anyone would, no matter how badly things have been going, they'll just completely get kicked out today or something like that. I hope not.
Nick has had to contend with a lot to get into surgery school.
I'm proud of what I've achieved in life so far, but really my debt is to, or my parents mainly, for encouraging me and pushing me and almost forcing me to make sure I did what I could with myself. If it wasn't for those around me, I wouldn't have achieved that.
In the next half hour, Nick will find out if he's done enough to make the grade.
Afternoon, Nick. Could we have your portfolio if you have it? If you'd like to give that to Mr. Curry.
Sure.
Anatomy. You have attended only 28% of anatomy. What happened there?
I don't think it was as low as that.
You missed 10.
General surgery, you do a week of nights.
It's one of the lowest attendances we've had in the whole year. Okay.
Now the panel want to see if he's near the 120 operation target.
Let's stop there. Total of 69 this year, is that correct?
Yeah, I think that sounds about right.
Okay, that's pretty much bare minimum. We were expecting more than that.
Do we need a discussion, I think?
Would you mind just stepping outside just for a couple of minutes? We'd just like to have a little discussion, then we'll call you back in shortly.
Shall I just play at the door?
Please.
Yeah.
Thank you.
Can you finish yet?
All right.
Having some kind of discussion and they're going to call me back in a minute.
He's not quite there, is he? But I'm a bit unhappy with that combined with his poor attendance and his poor performance in the evaluation.
The panel can pass or fail him, or ask him to take the year again.
What do we think?
So what's going on there?
Nick, come take a seat. We've had a little discussion. We feel that you're probably not in a position where we can allow you to progress to next year. Okay. And we'd like you to repeat the CT 1 year.
Really?
Yes. What do you think about that?
I think that's a bit harsh. I mean, I know the assessments haven't done that many assessments, but I can always still do them by the end of the year.
But I think it's a whole host of things. If it was just one, we might just sort of think, well, that's something that can be tidied up. But it isn't. It's too many things in one parcel. And I think if you had another year, you could put all that right.
Yeah, I agree, but I think I could put most of that right before the end of it this year even.
I think there's too much to be put right in the space of time. But surgery isn't like that. It's got to be something that's inbred, something that you learn as you go along. You can't just put it right in 2 months. Okay. Okay. Thank you for coming.
Cheers.
All right.
Bye-bye.
There you go. It was all right. They want me to do the year again. Because I didn't do enough assessments and I didn't go to enough for the teaching. So I said, fair enough. If that's what you need me to do, I'll do it.
The panel have given him a second chance. He won't get another. All 10 of our trainees have come a long way this year.
Rishi, come and take a seat.
Rishi began his training making basic errors.
You can't do an appendectomy, you can't do a hernia operation till your knot tying and your suturing is absolutely slick.
Only 2 validated out of that many. Golly, what happened there?
There has been quite difficult.
He's learned his lesson.
Passed. I'm happy. I'm relieved and I'm happy.
Anita had to overcome an early setback.
Just knocked my dressing off with my skin graft off.
Right, I think the panel agrees that you've made satisfactory progress for this year, so well done.
It's nice to just get that out of the way and you can get back to work and get on with life.
Smittesh had to wait in line for his chance in orthopedics.
That's pretty much bare minimum for the year. I mean, we've let you through the skin of your teeth there. Okay.
I feel good. Yeah, I'm relieved and I'm obviously happy.
And Andy and Honor were delighted to make the grade.
I passed. I think the kind of biggest feeling that I'm feeling is, you know, really pleased, really happy. I don't think I can get the smile off my face.
Perfectionist Nicola struggled in early operations.
I feel like I can't get deep enough.
She had a shaky hand and had to take some criticism.
I'm hoping she's not going to be disappointed after this failure.
I can eat things over in my head. I think everyone has those days, don't they?
Her nerves got the better of her in the practical exam. She's unsure how well she did. Now, after a year of worry, she's going to find out if she really is cut out to be a surgeon.
Wouldn't mind giving Mr. Curry your portfolio?
Yes, of course.
Okay, let's just see what you did on here. Anatomy, nearly 80% attendance. I think we'll give you that. 78.6%. Okay, could you just scroll down to the bottom so we can see the total for the year? 114.
She's actually improved a lot in her practical exam.
In October, way back in October, you were in the 6th decile, and this June you were up in the 3rd decile. Okay. So that's a good improvement because everybody's scores went up, so the whole group went up. So for you to actually go up and go further, that's actually quite a good result. So well done. Okay, are we happy? You happy? Yep. Okay. All right, that's satisfactory to proceed. So congratulations on that.
Lovely, thank you.
How'd it go?
Okay, I passed, so it's fine.
Nicola's made it. She's got one foot on the ladder to become a top consultant.
The nicest thing is in 10 years' time, having new colleagues who you can remember when they were in their first year.
Ivonne got her top choice of speciality for next year in plastic surgery. Nick is looking forward to proving himself. And Nicola is one step closer to her dream of becoming a consultant.
It's been an amazing year and it has had its ups and its downs, but I'm definitely a surgeon compared to where I was at the start, yeah.